On Kawasaki disease. So today we're diving into Kawasaki disease. It's a condition basically causes inflammation in blood vessel walls, mostly hitting the heart arteries in young kids. Okay, first up, think of Kawasaki disease kind of like this big inflammation that goes after the body's blood vessels, especially those smaller ones. Now, the tricky part, it can look like a bunch of other kids' sicknesses. So what you're really watching for is a high fever, right? Over 102 degrees Fahrenheit, lasting 5 days or more. Plus, you need at least 4 other specific things, maybe a swollen gland in the neck, really red eyes but no gunk, a rash, or that classic red peeling skin on hands and feet. Second, and this is super important, timing is everything when it comes to reducing complications. You got to get treatment going within 10 days after symptoms first show up. Seriously, that's key to cutting down the risk of long-term heart damage. And listen, this 10-day window, it counts even for what they call incomplete cases. Where maybe a kid has that long fever but doesn't tick all 4 of those other symptom boxes. Doesn't matter, getting help within those 10 days is still critical. And finally, even though it is treatable, Kawasaki disease is actually the top cause of heart disease that kids get not born with in developed countries. Yeah, if it's not treated, that inflammation can cause the heart's artery walls to weaken and kind of bulge out. That's called an aneurysm, and it's serious stuff. Who's most at risk? It's mainly the little ones, kids under 5 years old. So the key takeaway here, spotting that stubborn fever and those telltale signs early on, well, that's just absolutely vital for protecting a child's heart down the road.